For those of us that like that glow after a hot summer day, let me ask you this. Is that glow that's only gonna last you about 2 to 3 weeks really worth surgery, chemotherapy, or even a shortened life? Or if you don't glow but turn into a red hot chili pepper, I'm sorry in advance, it does look like it hurts. But whether you're a glower or a pepper, listen up, because this does pertain to all of us. So we are generally familiar with the term cancer, but if you're not, cancer is an overgrowth of cells that can cause harm to our bodies. There's two main types of cancers that we're very familiar with, which are breast cancer, mainly found in women, and prostate cancer, found in men. But not much attention is given to cutaneous cancer, which is skin cancer. Because it's not as familiar, it is important that we know how to identify it, the types there are, and the treatment options available. Our skins, for the most part, we do have something that are called beauty marks. So it's very important to know the difference and identifying what is normal and what is not normal. So beauty marks usually consist of birthmarks, moles, and even freckles. But there's one that I really want to stress to you today, which are called sunspots. Sunspots are dark color spots on our body caused by sun exposure. The risk of skin cancer does increase as sun exposure accumulates on our skin. So if you're at the beach every other weekend, what do you think is happening to your skin? There's a self-evaluation with the acronym ABCDE. So it's not YMCA, it's more like A, B, C, D, and E. The self-evaluation is the most effective way to examine yourself at any given moment. The signs to look out for are asymmetry, borders, coloration, diameter must not be bigger than a pencil eraser, and the evolution if it's changing. Our beauty marks are located on the outermost layer of our skin out of our 3 layers of skin, called the epidermis, which is the outermost, which is usually where the different types of skin cancers begin. There are 3 main types of skin cancers, which are called basal cell carcinoma, squamous cell carcinoma, and melanoma. Basal cell carcinoma is the least aggressive type because it's slow growing, and although it can invade that second layer of skin, it's not likely to go to that 3rd layer and spread to other surrounding tissue. Squamous cell carcinoma is the second most common type of skin cancer. The American Cancer Society reports that 2 out of 10 people diagnosed with skin cancer result to be squamous cell carcinoma. Squamous cell carcinoma is a bit more invasive than basal cell, and it can travel to that 2nd and 3rd layer of our skin with the potential to invading the surrounding tissues underneath. But melanoma is the most aggressive form of skin cancer. Melanoma is the overproduction of melanin, which is responsible for creating our skin color and that glow that we so love so much, and it does create our natural sunscreen. Melanoma is known as the deadliest form of skin cancer because it can spread very quickly to the surrounding tissues underneath. Bob Marley, for example, we know, a lot of us know him, but I'm not sure if we all know that he did pass after being diagnosed with malignant melanoma on his right toe, his right big toe. The most affected areas are usually the ones with the most exposure to sun, such as the scalp, face, ears, arms, and the back of our hands. I remember a patient telling me that he had skin cancer on his scalp. He asked me, do you want to know how it happened? Of course, out of curiosity, I said, sure. He told me, well, I was lifeguard when in my younger days. I used to do it every summer. You want to know why I did it? For the ladies. A skin biopsy is necessary to make a definitive diagnosis for skin cancer after properly identifying the type of skin cancer a person has that will determine their treatment plan. There are 3 types of treatments available. Cryotherapy, which is also known as cold therapy, which is really cold liquid nitrogen used to destroy cancer cells by freezing them. Right over here. There's also the option of surgery, getting it surgically removed that way. And there's also chemotherapy, which in this case consists of a topical chemotherapy. So chemotherapy uses anti-cancer drugs to kill off cancer cells. Topical chemotherapy is used for skin cancer. The cream is called Effudex. Skin cancer is very serious, so make sure you're really paying attention to your body. If it doesn't look right, get it checked. Wear your sunscreen as much as you can, because beauty should never cost you your life.